first question. The project's name is Transcendent.
Yes.
That is an acronym.
It is. It's a long one, too.
That's a crazy acronym. So what does that acronym stand for?
So I'm going to try to remember. Transforming research by assessing neuroinformatics across the spectrum of concussion by embedding interdisciplinary data collection to enable novel treatments.
Okay, who came up with that?
I did, actually.
Okay, of course you did. Okay, so now that you've explained what the acronym stands for.
What does it mean?
What does it mean? What does it mean?
So in the past, a lot of concussion would do things various ways, and it had very little standardization across all types of people, all types of mechanisms, all types of past histories, all genders, all sexes. And what we are doing with this research is we're going to standardize the way we collect the data for all patients, and not just the physicians, but the other healthcare providers so integral to the care. So the physios, the OT, the mental health providers, and layered on top of that, we're going to be doing even more advanced physiological measurements, things like looking at their heart rate, blood pressure, looking at biomarkers, which we'll talk about maybe in a little bit, to come up with what are the best ways to diagnose concussion, figure out how well they do, who's going to do well, who may not, and then come up with treatments that can better advance the care of all the people we treat, such that they can get back things doing they love to do, including doing their physical activity in sports.
Exactly. Okay, that's a huge project. This is a huge investment in Canada, in Ontario, in Ottawa.
Yeah.
But this is a large team that's involved in this project, right? A large team of people
Absolutely.
involved.
It's a pan-Canadian team. We are so grateful for the Ontario Brain Institute for supporting this research. For over the full project, for a full 5 years, will be over $11 million. We're also so grateful for the CHEO Research Institute and the 360 Concussion Care, and the institutes, almost 20 across Canada and North America, who have scientists involved in this project.
Okay, that is significant. Congratulations,
Thank
Roger.
you.
That is so incredible. So you've shared a lot about what the project is all about, but what are the main goals of this project?
So a lot of the previous research were based on what scientists wanted to study. And that's important, but it doesn't always get to the root of what we need to answer. And one of the things that our team did recently was complete what was called a priority setting partnership, in which we engaged over 1,000 patients with lived experience of concussion and their caregivers, and then also got healthcare providers, not just the researchers and scientists, and then came up with the shared priorities. And with that, there were a top 10 list, and we feel that with this research, we're going to answer most of those questions on the top 10. So better ways to diagnose, better ways to treat, better ways to come up with novel tools to even manage as well.
So what are some of those novel treatments? Like, can you give us some insights?
Yeah, so some of the things we're going to be studying are novel treatments, and we're going to be hearing later on from my close colleague and friend, Dr. Ledoux, and I want to steal any of her thunder, but she's going to talk about an app that's been developed with the MoBio company to look at mindfulness. So Dr. Ledoux will talk more about that, but that's a novel treatment that people can manage their own, perhaps, mental health sequelae and prevent ongoing symptoms. We're also going to be looking at novel ways to assess concussion. So some of the examples of the things we're going to be doing is, we believe a lot of concussion symptoms may be due to what's called autonomic dysfunction. That's living too much in fight or flight. One way to assess that more accurately, rather than relying on self-report, is putting people on what's called a tilt table. So we tilt them up and down on a bed that moves for them, and we measure their heart rate variability, their blood pressure at different time points, and that may give us a better measurable way to see if they're having that autonomic dysfunction. We're going to be looking at what's called salivary biomarkers, so painless. They just have to spit into a little collection tube, and we're working with one of the scientists at Penn State in the USA to look at what's called microRNA. We're going to be collecting blood to look at some of the proteins. We're going to be doing advanced neuroimaging, like research MRIs, to look at how the blood flows through the brain, to see are there actual measurable ways for concussion, and then even some really things that could be used anywhere. Working with things to look at how the eye reacts to different stimuli of light, how our eyes follow, not just by my finger, but by using equipment, very advanced equipment, to see how well the eyes track.
This is exciting stuff, Roger. This is leading edge research, leading edge research. Now, For the sport leaders in our room, do we have a specific call to action for them? Like something sports should be thinking about, should be planning for, anything they can help with, or?
Well, I think this is something that getting all on the same page is so important. That's what we're trying to do with our research by getting everyone involved. Let's do the same on getting our discoveries to the same people in a harmonized way. And we are doing that already. We're working with you at C.r.a.n.s.c.e.n.d.e.n.t and Parachute, with our adult guidelines that led by some of our partners, by our pediatric guidelines, and really trying to harmonize the information that we can get so people know where to go, that it's trusted and up to date.
You know what? This is so very exciting for you, for Ottawa, for Canada. And as you know, C.r.a.n.s.c.e.n.d.e.n.t is thrilled to be supporting you along the way in the way that we can. And I look forward to hearing more about this exciting project as the months and the years go by. So I know you're a busy guy. I know you're running around from hospital to clinic to here. So thank you so much for joining us, Roger. And I wish you a great rest of your day.
Thank you, Kim.
Excellent. Well, thanks again.